So today I'm here with the lovely people from Clinichub, and I came to Turkey to support my sister. She had gastric sleeve surgery, which is the same surgery I had in December. And as you guys can see, if you've been following my journey, I've lost quite a lot of weight, 20 kg since then, so I'm really happy. I think it's best actually for you guys to introduce yourselves. Who wants to go first?
This is Bashar, Director of Clinichub, and Ms. Osman, also here, our Clinichub Bariatric Coordinator, General Coordinator, and Dr. Ahmed also can introduce himself.
I am Dr. Ahmed, a postdoc care doctor in Clinichub.
And I'm Dietician Duygu from Clinichub.
So I get a lot of questions about my experience, about the company, so I thought today would be a good opportunity for me to meet up with the guys, seeing as I'm already here, and answer some questions, and they'll help me answer as well. So I think the best question to start off with is, what exactly is bariatric surgery? So is this a doctor question? Yeah.
So a bariatric surgery, it was what we call a weight loss surgery, because we know not all people are able to lose weight. This is a very person-related thing. Some people just gain weight so fast, but they cannot just be able to lose that weight that fast. And this is what we call a bariatric surgery. We have a couple of surgeries, including the gastric sleeve, gastric bypass, mini bypass, like some transition bipartition. You know, like it's depending on the patient case and its requirements for sure. Their BMI is depending on if they have any other like chronic diseases like hypertension, diabetes. We are deciding the type of the surgeries according to those factors, but a bariatric surgery means a weight loss surgery.
Yeah, and the one I got in particular was the gastric sleeve.
The gastric sleeve one,
yeah.
Exactly.
Okay, good, thank you. Okay, so the second question is, if you are interested in bariatric surgery or the gastric sleeve, like how do you book? And we'll,
that's my question.
Yeah, exactly. So what happens after someone books?
Let me start with how you can book your surgery actually. So if you're interested in having bariatric surgery, the only thing that you should do is, go to our website or our Instagram page, that is Clinichub Bariatric, and you can just, send us your details, your name, your email address, your phone number. You'll be immediately contacted. And then afterwards, of course, we are going to be giving you all the information that you need. And then, your assessment starts. And if you're suitable, after that, everything's going to be arranged by us. And you don't have to think about anything else.
Yeah.
The most important part here is, as Clinichub, actually, we are giving all inclusive package here.
Yes.
From the start to the end, and we are giving everything. Our dietitian support, even the vitamins, everything is included in the package.
So once you book, you will not need to do any arrangements, anything else. Everything else will be sorted by us.
Yeah, I was literally gonna say it was a really easy process. You
Was it?
just very. I'm honestly not just saying that, it was very easy. Just contact them and then they literally sort out everything, even including transport. So, yeah. Okay, so going from there, how much? What's the price like? What's included? I think people would like to know.
So if you want to, talk about in detail for the package, as I said, it's an all-inclusive package, which means once you book your flight, once you, put down your deposit, once your date is reserved, afterwards, when you land here, we're going to pick you up from the airport, take you to the hotel, your PCR tests are included, all your, pre-op tests are included, and your surgery fee, of course, in the hospital is included. So all the service that you're going to need, you're going to receive here within the package until you go home. And of course, when you go home, as well, your medication, your supplements, everything else is included, including 2-year dietary support. You are going to be followed by our lovely dietitian here. There you go. She's going to be, nagging all the time,
In a good way. In a good way.
In a good way. Yes.
Price actually depends on lots of things here. Medical history and your surgery type is everything.
Definitely.
Every price can be changed to these kinds of conditions.
And
First
we
of all.
should say packages can be
Packages
altered
also
according to your needs as well.
Also, some of our patients, they require more stays in the hospital or in the hotel. But
That's true.
normally in our package, we just tell them to stay at least 4 nights in the hospital and 2 or 3 nights in the hotel. But our price is ranging from 2,500 to 3,500 British pounds.
Yeah.
Yeah.
Yeah. So you guys can convert that if you're from a different country, because I know I have many people that follow me, but that's in British pounds.
Right.
Yeah. Okay. The next question that I get quite a lot is, what is the minimum or maximum weight for this surgery? So I think you can answer this.
Okay. Well, this question has different answers as well. It's not easy to give a direct answer because your qualification depends on your medical history. That's why we require you to send us a medical history first, so you can be assessed by our doctors. But we can say usually a minimum BMI is about 35. But of course, there are other things that contribute to this. So we have to, check your
Medical history.
medical
Yeah.
history
Right.
and then decide. It can be it can be slightly lower, or it can be higher than that as well.
Okay. I like that you didn't say a weight number, because people kind of focus on that instead of.
Actually,
But my goal is to actually have a healthy BMI, not a number really.
that's
Yeah.
the idea. Actually, you
Yeah.
shouldn't obsess on going down to a certain weight. You should, actually obsess on being healthy.
Yeah, exactly.
And also, I want to add a small little point, because some patients, they think that they are 35, but because some countries put regulations regarding their BMIs, just for example, this country, we are not operating on BMI less than 40 to do a weight loss surgery.
Okay.
But they are 36 and they want to do a surgery, and they are scared, like, if I'm 36, is it safe for me? Yes, it is safe. It's just a country regulation thing. Your
Okay.
country is not operating on you, but if you come here in Turkey, our regulations are allowing.
Okay. I
And you
understand.
were like 35 or 36.
Yeah, yeah. This is for you. So, what is the pre-surgery diet like? Yeah, dietitian. Yeah.
Our patients need to do diet before the surgery. I always keep in touch with my patients before the surgery, like 2 weeks ago. And they need to do at least 3 days before the surgery, but it's also up to BMI. So if you need more, I always say let's do 7 days or 10 days, because it reduces the liver volume and it reduces the risk of surgery complications. That's why it is very important. Also, you can get used to have new habits, new liquid diet that you will do after the surgery.
Yeah.
That's why it is very important you to do this diet. I can talk about the diet if you want. It's like a liquid diet that you did before.
Yeah.
So we will have only liquids like 3 days, at least 3 days. So we will have light milk, light yogurt, vegetable puree or fruit purees, or maybe herbal teas, coffees without caffeine, or well blended soups without any particles, any bits. So it's not that much hard, I think. It's like a
I'm just kidding.
We will do this diet after the surgery, like 10 days.
Exactly.
That's why you need to get used to have this diet.
It's really helpful. Yeah, it really
It
is.
means the experience starting before you come here. Actually, 3 days, at least 3 days, you come here.
Exactly.
Your experience is starting.
Yeah, exactly. So it's
very
not
important.
just when you get to the hospital or arrive in Turkey. It actually starts from your home country. So we spoke about the pre-surgery diet. Now, what about the post-op diet? What is that like?
We have 4 steps about post-operative period. So steps are very important and it's different from patient to patient. That's why I don't want to say the certain dates or certain days. But first step is like a hospital diet. It is clear liquid diet that you need to do at hospital. So please drink only liquids that your doctor and dietitian approved. And please drink only liquids that hospital staff bring you. Second step is also liquid diet that you will do like 10 days after the surgery. And liquid diet is very important for your body hydration. That's why make sure that you drink enough. I mean 2.5 liters is very important, and you should drink at least 1 liter water for your body hydration. That's why just focus on how much can you drink, and please count your liquid consumption. Also, we will provide you like protein shakes that you need to take. It is very important you to have, especially for your first month.
And they taste nice.
Very nice.
Yeah, really,
Have some
honestly.
flavor.
What's the best flavor?
Vanilla. Sorry.
Everybody loves that. And we need to mix it with lactose-free milk or water. It's also up to you. But it is very important because we will not eat any foods which contains protein in it. That's why we need to supplement our body. Also, we can have lactose-free milk, lactose-free yogurt, or herbal teas, or well-blended soups. Decaffeinated coffee is also okay for us. Just liquid diet. Also, you may have fresh fruit apple juice without any sugar, but I just want you to add some water on it, diluted. And step 3 is more enjoyable, so it's like a pure diet. So
Till now, it was very hard.
Yeah.
my patient is
Honestly.
ready. I will start maybe 10 days after the surgery. So it's like we will have control days that I need to check my patients, like first week, second week, third week, fourth week, 6 weeks, then monthly, then every 3 months. And if everything is okay, if my patient is ready, we will start step 3, which has egg, cheese, minced meat, well-cooked vegetables, peeled fruit. So we will start eating and we will start chewing, but make sure that you chew a lot because it can stuck here if you don't chew like 15, 20 times before swallowing. And we need to...
Sorry.
How was your
Flashback. It just happened one time.
Or you may have nausea, vomiting. That's why it is very important to learn. It's very important to know your new stomach because
Yeah.
it's a new stomach, it's a baby stomach, and you need to
Yeah.
know your stomach as well. So it is very important to eat slowly also. Then, if everything is okay, we will increase our protein consumption day by day. Every week I will check, and every day I will let you to start some foods or not. It's also up to my patient. And fourth step is bariatric balanced diet. It is very important you to follow a dietary program after the surgery. That's why you need to be followed up by bariatric dietitian on this process. Because first year is very important. You to have new healthy habits. Also, you need to change your lifestyle. You need to learn how to make your foods. You need to do like 5-6 meals in a day. Every 2-3 hours, you need to have a meal. So it is very important to have new portions and new food options. That's why you need to have a bariatric dietitian on this process.
Yes, definitely.
Because after 1 year or after 1.5 years, you may regain weight. I don't want you to regain weight. That's why I will follow you up like 2 years.
Yeah. With my experience with this, I think it's really good that you mentioned the different stages because some people think getting weight loss surgery, either of them, yeah, exactly. They literally think it's just a quick fix, and it's really not. You have to prepare yourself, do meal prepping, change your lifestyle because it's a big thing. It's not just an easy decision to make. And yeah, it's been good for me so far, especially because I do know some people that have done it in the past, so that did help. But doing your research is really important and following your dietitian's recommendations. So yeah, it's really good. Okay, so I think this one's going back to doctor. So the question is, are there any side effects? Do you know this? I could also say some as well.
Okay.
Or complications or...
I think
It's a very long topic, actually.
Yeah.
Okay.
If we talk about complications and side effects, but from the side effects is what we call like an embolism, and this is very common because the surgery is like taking time, and the patient is staying over the bed, and after the surgery directly they are not able to move much. So during the immobilization, the patient might have an embolism. But we are trying to prevent that. We are giving blood thinners to the patients.
Yeah.
We are giving these compression socks that they have to wear during the surgery, and too many other things that we are using just to prevent this complication. Okay, the other side effects are more of like very simple things. Like patients just experience due to anesthesia some sort of like nausea, dizziness, like fatigue, tiredness. They are not able to stand. Yeah, they are like very common things to happen. And also it differs from a patient to another how they tolerate the surgery. Like some people just stand directly after the surgery, like within 2 hours they will start to walk and
My
move
sister.
and do it. Yeah. I mean, it's like a miracle thing. Some people just like they stay one day and they are not able just to stand from the bed or something like that.
Yeah.
So it's
If
a
I
totally
can add
person
something
thing.
to that.
Yeah, sure.
Of course, with surgery comes, complications and side effects. But what we're trying to do here, we have so many pre-op tests before you go under anesthetics, before you go, for surgery, that we want to, minimize everything. We want to make you, we want to make it optimal for you to go under this surgery. We do blood tests, we do ECG, chest X-ray, ultrasound, anything we can test.
And endoscopy as
Endoscopy.
well.
Yeah,
It's so
endoscopy
important to
as
see the
well.
stomach before.
So we want to make sure you are, healthy enough to go under surgery.
Of course.
But of course, again, risks,
some-
risks
it's
and
risks
complications
anyway.
are there.
So
Every single surgery
has its own
has
risks.
its own risks.
Yeah.
And here we are just collecting all the medical history.
Yeah.
All the surgeons are just checking and evaluating these medical history forms. And also, as she mentioned, even the diet is starting from 3 days before the operation, and it is just to, as she mentioned also, to minimize these risks,
Yeah.
the risk of complication. This is the most important part here.
Yeah.
But everyone should understand that this surgery, of course, has risks, and there is a risk of complication, of course.
Yeah.
At the same time, I don't want to scare the people.
Yeah, no, I
Because
understand.
it's very simple surgery. It's not
Yeah,
taking 40 minutes of work.
Yeah.
And it's done laparoscopic. It's just doing small 3 incisions or 4 incisions, and they are just everything is with a camera. So
Exactly.
it's a very simple and fast surgery. But the last thing just I wanted to ask for every person before they come, and even when they are seeing their surgeon during the consultations, they have to ask the surgeon, what are exactly my risks? What are exactly the complications that I might suffer from? Like on the short term or on the long term?
Yeah.
Just a small little thing, because a lot of patients are suffering from this on the long term complications, which is a vitamin deficiency thing. I think that why our lovely dietitians also do, she is also advising the patient from time to time they need to go and get some blood tests.
Yeah, I had to do that at home.
To measure like some vitamin B12 and
Yeah.
vitamin D, and every 3 months vitamin E. Like
Yeah.
most of these vitamins, patient might suffer from deficiency, and they can cause some like medical conditions.
Yeah.
That's why they will advise
But
you
we
what you
should
have to
say
do.
that these are temporary.
Of
This
course,
is temporary for sure.
it
It's
is.
correctable,
It is.
actually, yes.
I had to get a 3-month post-op blood test, and I was just low in vitamin D, and then I got my tablets, and I've been fine.
Usually anyone
Yeah,
is low
I didn't
in
even.
vitamin
Yeah,
D,
exactly. So
especially in UK.
exactly. So it wasn't. It wasn't a big deal.
You are in UK,
Yeah. Yeah.
Probably
Exactly.
your vitamin D is a bit low.
Yeah, but it was good to see that everything was okay. Just that small thing.
The
And-
deficiency in vitamin D not causing a lot of side effects for the patient, rather than the vitamin B, which is affecting the nervous system and the nerves themselves. So the patients just start to get so agitated, and like they start to be so nervous, their hands are shaking.
Yeah.
There are all signs, for example, for vitamin B deficiency. This means they need to get it checked.
Okay. Okay. That was very in detail. Very. Thank you. Okay, so I'll take it back to something. Maybe I don't know who can answer this,
Booking
but
related.
yeah, exactly. So it is booking related. Can not me? Can they bring someone with them for support?
Of course.
Yeah.
Of course.
What I always tell to anyone, who is interested in coming here for surgery, I understand that you're feeling scared because you're traveling overseas to a country, usually the language you don't know, and you may want to bring someone for support, but this is something you only need psychologically, I think, because all the support you need, we're actually providing, because we have, nurses in the hospital, coordinators in the hospital. Also, when you go back to the hotel, we have nurses here, we have a doctor in the hotel, which is really, it's not a common thing in other clinics, I think. So anything you need will be, provided by us, and we'll be supporting you. But I understand, having someone you're familiar with
is
makes
good.
you feel better, especially after having surgery.
Exactly.
So it's not mandatory, but if you want to bring someone, definitely we arrange everything for them as well.
Yeah, just like I came with my sister, so it's possible. It is possible, and it's been very comfortable for me. Yeah, of
course.
Yeah. So this is something that I personally get. Not that I have, but many people have asked me about loose skin after surgery. So I think I'll answer this question. So This really depends. I don't know about medically, but it really depends on different factors, I guess, like your age, your size that you were before surgery, your diet.
Even your skin quality.
Exactly, yeah, skin quality. There's so many different things, but I know people ask me, what do I have loose skin? I think bingo wings is normal. I think this is normal. So, and plus, the UK has been in a lockdown, so gyms have been closed even before I had my surgery. It's not a good excuse because I can work out at home, but yeah. But I've been doing small exercises, so it's not bad, I would say. And then I've got a small pouch, so it's not a big deal. But it really depends on different factors. How really you can combat this? Yeah, I don't know exactly. But
I do have an answer for this.
Okay.
As you said, it's really dependent on the person.
Mm-hmm.
I've seen, people who were, not too overweight, or, for example, a patient who weighs 100 kilograms and another patient who weighs 120.
yeah,
It's not going to necessarily mean that the patient who is overweight is going to have more excess skin because they've lost more weight. It depends on your skin quality, it depends on your age, because if you have tight skin, actually you can tell as well, if you have tight skin, it means it's going to shrink more. But if you already have, especially actually, stretch marks are a good sign for that. If you have stretch marks, it means your skin already expanded. So when it goes back, it's not going to be too tight.
okay. And also, I guess, how quickly you lose your weight as well. Yeah, so there's loads of different factors with loose skin, so it really depends from person to person.
And exercises is very important point actually.
Unfortunately, I'm joking.
To help
It's not
lose
easy
weight.
to exercise at home. Very hard,
No
you know.
motivation for that.
There's no motivation, nothing.
Yeah.
Also, we have
But
the
like-
solution for it as well.
Yeah. Oh my goodness.
So-
Yeah, that too.
Again, the
So
same.
no, but
won't
that
say
is
no.
true. Like later down the line, I know some people actually do have to get skin lifts and tummy tuck. Yeah.
tuck.
So
Tuck surgeries, yeah.
yeah, it is. Some people do opt for that. I'm personally not, because yeah.
After 1 year or 1.5.
Yeah, you definitely need to let your body relax and heal.
It's
Definitely.
very important actually. Your weight should be stabilized first of all to get any plastic surgery, to
Of
get
course.
any tummy tuck or the lifting surgeries. Your weight should be stabilized because we don't want any fluctuation in your
Right.
weight. And whenever your weight is stabilized, you can think about getting the plastic surgery. Right?
Yeah.
You reach your goal.
Right.
I think the important thing to remember here with weight loss surgery is you want to be healthy.
Yeah.
So
Of course.
after that, I think when you're considering a weight loss surgery, you shouldn't focus on ending up with excess skin, because what matters is that you are healthy,
Of course.
not how you
you look. Yeah.
It's important too. You get my point.
Yeah, no, I understand. It's true. Thank you. What's the best advice?
We will ask you some questions.
Okay. Yeah, ask me. So I guess ask me.
What is the hardest part on this journey? Which one is the hardest part?
The hardest part for me.
Booking also can be the hardest part.
Oh, on your end.
No, I'm joking.
For me, the hardest part is definitely mentality, because obviously you've done a surgical procedure, but sometimes you forget and you have old habits that you need to kind of forget, but it takes time. So, for example, if you don't have the correct size bowl or something, your head may want you to put more food than you're supposed to. So I told you guys in a previous video that I've changed my cutlery and my bowls to match what I'm actually able to eat, because then you just feel kind of discouraged if you can't eat a lot. Or another thing I've also found recently, because the UK has opened up for outdoor dining, is going out to eat with other people. So you get full very quickly, and it's not easy, but just know that you can order appetizer instead of a big meal. It's not really that hard, but you do get used to it. So I think for me, it's the mentality,
Right.
the psychological behind
What
it.
about the soup in the hospital?
Oh God.
Nobody
Let's not go in there.
does. The problem is we are changing a lot of hospitals from time to time, and all of them are getting the same complaint.
But imagine, no seasoning, no oil.
Yeah, and I'm African too, so I like my seasoning, I like my spicy. Yeah, so you have to get used to it. But I know that it's for good cause. Yeah. So,
Of course.
but yeah, for me, that honestly was the hardest part, or is the hardest part. The process itself for me has been a breeze, and that's why I speak so highly of it. And I even brought my sister here because everything has gone smoothly, and with her as well so far. So yeah, I have a question for the doctor.
All right.
So this is, I don't get it. I don't get this question asked a lot, but some people have asked me about pregnancy after weight loss surgery.
Okay.
Yeah.
Actually, the surgery itself is not interfering at all with pregnancy. So every woman who can get sleeve surgery or any type of bariatric surgery, she is very safe to be pregnant after a certain time, after she get recovered. Because as I said, the body needs time to heal. And after 1 year from the surgery, a woman is completely fine to get pregnant. But when she gets pregnant, as I told, because there is some risks for like vitamins deficiencies, she has to be following that with her gynecologist in order to make sure that everything is going smooth, but it's not interfered with pregnancy at all.
Thank you.
Actually, I want to add something to this as well, 'cause this is a question I get commonly.
Oh, really?
So I usually tell my patients that, this surgery has no negative effect on your fertility. We just don't want you to get pregnant in the first year because it's going to affect your weight loss as well. But we have seen that, people actually do get pregnant more easily because you may experience some hormonal problems when you're overweight.
Yeah, that's true.
The more weight you lose, your hormones are balanced. So it actually, in a way, affects your fertility in a positive way.
That's true.
Yeah, that's true. That is, yeah. So the last question for me, I think for my dietitian is, do you think I am on track? And then I'll answer too. So you see me from the beginning to now.
Let me ask you, how do you feel now?
Okay, answer. So I honestly feel great. I know how I felt before surgery, and I didn't feel good at all. I feel lighter. I still suffer with back pain, so sometimes I slouch, but the weight and the pain from my back has reduced a lot. And yeah, the one thing about this surgery is that a lot of people like to compare their weight loss with other people, but I've learned that, first of all, I don't want to be too small. I want to be healthy, and I think that my weight is maybe a bit slow, but I'm happy with it. I don't want to be too slim. Yeah, so exactly, yeah.
4 or 5 months more.
Yeah, so I'm happy with my results, but I have the question. What do you think?
I'm also happy about your results because you are losing in healthy way. I mean, you feel good, you drink enough, you have your enough protein intake, and also your blood tests are all good for now. So I think you're on a good way, but maybe we can do more.
Yeah.
We need to do like 2-3 times a week to
Yeah.
protect our muscle mass, to lose more fat mass. It is very important to do exercise after the surgery. I mean, people are just doing walking, which is not enough for us.
Yeah.
So we need to do more exercise. That's why I recommend you to
Yeah.
do exercise.
The gyms are open again, so and I can get my bum back.
I have a very small little note because we had a patient who had tried to do weightlifting on the 3rd day after the surgery.
Whoa.
And this is very dangerous.
Wow,
Please don't do exercises like
didn't even try that
before
now.
asking specialists,
Yeah.
specialists, because you are not allowed to do weightlifting
Of
before
course.
3 months.
Yeah,
from the
that's
surgery.
quite soon.
Suggest some
We are
exercises.
doing some exercises,
But please ask your doctor. Or
Ask the doctor for sure, or
the
ask a
doctor
specialist
or-
about it.
Yes, specialist. It is very important because it's too risky for you. But for now, you can do anything.
Thank you.
Yeah, you're good to go.
Yeah. Okay. I think that's all. Those are the main questions that I got, and it's been like really insightful. Thank you very
Thank you
much.
so much.
Thank you.
Thank you
I'm
so much.
pretty sure you guys will be happy with those answers because it's not really easy making up your mind about getting this surgery. But yeah, thank you so much, and I'll see you in the next one. Bye.
Bye.